Hello, my name is Katie. I'm a paediatric osteopath working at Revitalise Clinic, and this is Carlie. So your official job title role is parent infant specialist, right?
Hi. So I kind of support parents with a kind of holistic approach to parenting, whether it's feeding, sleep, bonding, infant behaviour, but specialising more in kind of maternal mental health. So really thinking about when you just had that baby, adjustment to parenthood.
One of the main issues is sleep, right? So what would be like a common presentation you would see? Because I know you work for the NHS, so you would go out into the community. What's like a typical presentation you would see with regards to sleep issues?
So a lot of parents come to me and they say the magic, like, how do I make my baby sleep? And of course, it's so difficult to answer that question because sleep is such a broad
thing, isn't it?
So a lot of the issues can look around, babies not wanting to go in their own cots. That's probably the main one. So a lot of my baby doesn't want to be put down, that kind of thing, or they're waking up quite frequently. So I think it's a little bit about expectations as well, because obviously we do know in the first year babies are supposed to wake up in the night, which is really tricky.
And I think so, like, I saw a baby in clinic the other day and the parents said, oh, she sleeps through and she might wake up once of an evening, but she's pretty much sleeping through from 9 p.m. to 5 a.m. But I do think that parents just naturally think my baby's meant to just sleep all the time. But we know from research as well is that they don't even know like their circadian rhythm before like that 6 to 8 week mark. And even after that, most of the babies that I see in clinic, they're still waking up like 2 or 3 times in the night. And I think, like you say, there's so many things that come into it as well. Would you say that if there's a mum that say is really struggling with her mental health, would you say those babies are more difficult to sleep through the night? Or do they wake up more, those babies?
Really good question. I really think it's like kind of chicken and egg situation, because what we do see is obviously if mum is really struggling with her mental health, then babies can pick up on that, and there's a lot of stress in the home, or maybe mum isn't quite there as she would like to be, and therefore that can kind of affect baby's kind of stress response and nervous system, which we can actually see in sleep. Babies waking up very, very frequently, that then impacts maternal mental health. So it's a bit like which one comes first.
Like cat and mouse,
and it's also kind of dependent on the baby's temperament.
Yes.
Every baby is born so different.
Yes. I think common themes and patterns that I see in clinic are mums who have a premature birth. So if they've had a really stressful pregnancy, and then also if they've had a stressful pregnancy but their mental health was maybe not in the best place prior to falling pregnant, and then let's say they had a really traumatic birth on top of all that stuff, they're the ones that the babies are just like the most unsettled babies, and they cry for no reason even though they're like well fed and they have a clean bum and they've had a nap, they're just crying all the time. Do you see the same patterns with families that you go and visit?
Yeah, there's a very, very common link between the two, and it's because they've both been through so much stress and trauma. We see it a lot, and I think that also it's about knowing that it may happen at that beginning, it might be quite stressful. With the right support you can kind of get through that. That's when we have to think about what does the baby need, what does the parent need, and we think about actually how can we support them in the right way. But yeah, you do see a lot of that trauma, and obviously we know through science is the nervous system response, stress through pregnancy, traumatic births, already that's changed the nervous system in babies, and they're kind of getting themselves ready for that survival.
They're like ramped up, aren't they? And I would like, from like an osteopathic point of view, that's literally how I would describe those babies. They almost just feel like they've got a rod going through their back, and you just want to be like, just relax, just chill out and feel like you're a baby. But they're definitely the babies that are like, you can literally feel it in their bodies. And it was interesting because I read this one study about parents and mums specifically that have those kind of factors, like the premature birth, the poor mental health, the traumatic birth, and their cortisol levels are raised, and actually so are the baby's cortisol levels. So how your relationship with your mum will then affect your relationship with the baby. So are we bringing like the same patterns from our relationships with our moms onto with what it's like with the current babies, and then does that kind of affect sleep as well. Do you see stuff like that in terms of like the mum's maybe expectations around being a mum based on her childhood as well? Do you see stuff like that when you go out to families?
Yeah, that's actually, I would say, probably one of the biggest things, because people come to me with certain issues, but actually when we dig deeper, it's always around their own childhood experiences, and we see a lot of that trauma. Maybe they weren't validated, maybe they didn't get the right support, maybe there was a lot of emotional neglect going on, and so therefore they go into motherhood or parenthood for some fathers or other non-birthing people, and we think about, actually no, I want more for my baby, and so therefore they can put so much pressure on themselves to get it right, and therefore already set themselves up to fail. And then we also see the other side where that's just your default parenting, that because you've learned that through your own experiences, then you know we go into parenthood and kind of replay some of that, even though they might want different, it's still so ingrained in them. Keep that pattern going. That's where our generation are actually probably the first ones really trying to
make the
change.
And I know even myself, and I have quite a few patients who have said they want to sort their own issues out before they have a family themselves. I think now we're so much more aware of ourselves and how that's going to impact our kids as well. But what do you do with those mums that maybe have those expectations about being a mum that they've obviously kind of learned from their mum, and they almost like need to reset in a way, don't they? What's your advice to those mums? What do you do?
So it again, it's a really big topic because it's about looking at how you see yourself and how actually you then see yourself as a parent. So a lot of the work is kind of trying to actually be more mindful and aware of what is going on for you right now. What are the triggers? So what is it that your baby's doing that is triggering you right now? What kind of feelings is that bringing up for you? And then actually thinking about, okay, what's separate, what's baby experiencing? Because a lot of the time those feelings get mixed up. You know, actually, it may not be that your baby's seeing that, it might be that you're feeling that. And then a lot of it is then thinking about good enough parenting. So have you heard of that?
No, I haven't.
About the good enough parent kind of thing. There's no perfect parent as such. And I know that our society nowadays is all about everything you should do right, and
you know what I mean, ticking boxes.
So I'm literally thinking about what is good enough. And that's where we do a lot of observations in the room. You know, what's your baby actually communicating? What's your baby needing? Actually, you don't need to interact with your baby constantly. Having space, having breaks, that is enough. That's okay. You're still building that attachment.
I actually thought it was really interesting when you came into clinic to observe me, and we saw this baby in clinic that she was 3 months old, wasn't she? And basically, any time the mum put her in the car seat, she just like had a meltdown, like completely lost it. And her mum was obviously there in the car, and then as soon as she saw her mum again, she was like fine, wasn't she? And I thought you gave her such good advice, because you were like, keep exposing her to it, because she needs to learn. She needs to understand that mum's always going to come back, she's always going to be there, but you have to go in the car, and that's it. We're just not going to go in the car. And I think actually I see a lot of parents now that if, you know, say you wasn't there and didn't give that advice, they actually would stop doing those things. Like they'd be like, fine, we just won't go in the car, we'll just walk everywhere. So
honestly, the amount of parents that I see that like, I can't put my baby down, and actually they just need to know how to. How can you do that in the right way? You know, how can we support you and your baby to do these things that you want to do? And again, it's thinking about that lovely lady that baby just wanted mum all the time, and that's lovely, because actually we want to encourage that attachment. However, what we don't really hear about now is attachment isn't just being with your baby 24/7. Attachment is about coming and going. It's about saying goodbye and knowing that mummy's going to come back.
So it's more about like, you have confidence in your mum. Like, I know she's going to leave, but it's going to be alright because I know she's going to come back. It's actually also you filling your baby with confidence, so that they're okay with you not being there.
And that's why there's never like a one size fits all with families. So it could be one of the reasons. There's lots of different factors. When you think about survival, so babies are born to rely on adults to survive. They have to rely on someone, and so they see the world through their threat system. And so, for example, you know, when they're being held, it's lovely, warm, cozy and safe. This is great. But then when they're put down in an unfamiliar place, like a cot, because they're very little, you know, to start with, or they've used those lovely cuddles, they feel scared. You know, oh gosh, I need to call out for help. And so then what do? We usually respond quite quickly, pick them up. And so they don't really get a chance to experience their cot or their sleep places. they're actually communicating the more to be held. So this is where we then weigh up, what does that baby need? What does the parent need? Some parents that are breastfeeding, sometimes it does actually help them a lot to co-sleep at night, because babies are waking up more frequently, they're feeding a bit more, and therefore they can just literally feed while in the lying down position as long as it's safe, and therefore both mother and baby can go back to sleep and get some rest. Other parents that don't want to do that, and some parents don't want to co-sleep because they're really worried, they're really anxious about what that might mean, or maybe they've got some risk factors going on that it's not safe to co-sleep with baby. And then we do want to think about actually helping your baby learn that their cot or whatever it is next to me is safe, that nothing bad's going to happen to them, and that's done for a really, really gentle approach, because you see one or the other, it's either cry it out or respond and hold them all the time. But there's that middle ground.
Is it just about exposing the baby to that environment and not letting them, cry inconsolably, but they cry a little bit before you go in so they learn? Like, what would you do?
Yeah, so again, looking at the whole approach, because we want to think about their sleep environment first of all. Are they actually tired enough to go to sleep? Are they kind of they've got the right clothing on? Like the grow bag, if they're using on a blanket. Is it cool enough in their room? Is it dark enough? Those kind of things we want to kind of sort out first. A lot of my families I do recommend the putting down, putting up, and a lot of it is based on responding. So for example, you put your baby down and they start crying. A few, maybe 30 seconds to 2 minutes is not going to harm them. And then we build up that support. We want to again build that trust that we are always going to come. But it has to be, we're giving you space just to problem solve. What can you do here? And eventually the baby knows, well, no predators are coming. I'm okay.
I'm alright. I'm gonna be okay. But what I say to a lot of parents is to give them a bath, like have a really nice routine. So they'll have a bath, so it's like they're warm and cozy, and then you wrap them up, they're in their nice outfit, and then dark room, and then you could have some like white noise or something. Just starting with the basics, I think, is a really good to do.
So again, if we think about getting used to our surroundings, we can have that in a really dark, lovely, quiet place, but also the opposite, where it's quite chaotic and loud,
and they just they just crack on and I'm like, I'm going to sleep.
And also like newborns, if you think about newborns, actually research shows that they actually can habituate, which means they can actually their brain can get used to something, and that comes in with light and sound. So for example, babies can sleep in daylight. Babies can sleep with noise. However, it's about how many times their brain is exposed to it. Usually it shows that if they're exposed to it more, they kind of get used to it. For example, if they're school run and baby has a nap in the buggy, it's noisy, it's fine. It can kind of add a bit like white noise in a way. But then also we want to think about the temperament of baby and what the baby's kind of their environment and experience has been like. If they've had a really stressful birth, things like that, they might be a bit more sensitive. They might need a bit more of a quieter environment. More dark place. So it's not like a one size fits all in a way.
Have you seen much of where parents have conflicting ideas maybe around like parenting or sleep, like bedtime?
I mean, we see it all the time, and that's where again it's such a family approach, because we've got one parent who's come from their own background, their own experiences, their own learned behaviours, and their belief systems, their values, and also that's same for the other parent, and they kind of meet. They have this baby and it's like, okay, we've got to agree now. Everything that we've been through, which is completely different, can be quite similar. And it's like, okay, how do we now agree on this one thing? And that's actually really tricky. And we do find that when we become parents, there could be a lot of conflict in relationships because of this exact reason. And therefore, that's why kind of what I encourage my families is lots of communication. Actually sitting down, talking about what kind of style that you want to have. And if you don't agree on that, then how can you compromise? Because no parent's right.
I also think it's just really important to do that before you've even had a baby. Sit down with your partner and be like, how do you see yourself parenting, and vice versa, and you'd like to think by that point you would know kind of what they want to do anyway, but I imagine it's very different once you actually have a baby together and you're sleep deprived. I can imagine that it's stressful all the time.
The amount of arguments that maybe people have like 3 a.m. over sleep routines, literally what we're talking about right now, like sleep routines, and what are we going to do? And obviously no one's in the right frame of mind to have this conversation. So it is just literally sitting down together and really talking about it and agreeing on a plan. And also just remember that you can try something, and if it doesn't work, you can always change it. I would say with sleep, it's about consistency, but what we do find is something might not work, and also our babies are growing and their sleep needs always change, so therefore we need to change as parents.
Because I think, you know, I've seen some babies and they're sleeping well, and then it gets to that 3-4 month mark, and then they get a change in their sleep pattern, their sleep routine, and the parents that have had a good run, they're like, what on earth? Like, this is great. And then they suddenly are up and they're like, what on earth? But I mean, from my perspective, babies going through a lot of growth at that time. They're probably still learning actually different things wake them up when they get stimulated. So I think it's really normal to have those bits where they regress a little bit and then progress again. But I think mums especially put a lot of pressure on themselves to be like, right, they're 3 months old now, they're gonna sleep through, like, we need to do everything possible. And ultimately I think maybe as a society would be better if we just accepted that at least the first year it's gonna be rough, it's gonna be really tough. And I think I'm not here to give relationship advice, but if you have a partner that you really support each other, then you work together.
Oh, absolutely.
And I bet you've seen that so many times, like, and I see it all the time. The parents that come in that work well together, the baby is normally pretty settled, and not that they sleep perfectly, but they're normally better than the parents where, like, maybe they have conflict or they disagree on certain things. And I've also noticed that when mum gets stressed about stuff, the baby definitely does as well. So I can imagine that would 100% impact sleep. And then the other point as well is I think, like, mums today in this society are doing a lot. Mums are working, a lot of mums are working full time. Even when you've just had the baby, like, mums are getting straight into like baby groups, and they're going out like within the first few weeks, they're like going to meet friends. And I actually think that a lot of babies I've seen are just a bit overstimulated, so they sleep a lot in the day because they're like, this is exhausting. They're like, I've seen so many people say I'm so tired, and then at night time they're just like, wide awake.
Like,
so
asleep.
And I actually think that maybe, you know, like 20-30 years ago, maybe mums weren't doing as much. I know when I was at school, a lot of mums like didn't work, and now a lot of mums do work, and I think that's
so much more pressure.
It's a lot more pressure, and I do think that the baby picks up on that pressure as well. You know, like, we know so much about that 4th trimester and how the baby is just like another part of the mum essentially, and like they pick up on the mum's heart rate. They can actually match mum's heart rate as well. So any stress that the mum is experiencing, like, they're going through that as well, and understandably that's going to affect their sleep, isn't it?
So I think that it's such a crucial thing to think about, actually. What are their kind of strengths and weaknesses? So some parents quite are like doing the latter part of it when they're like, okay, I've had a block of sleep at, maybe I can sleep from like 7 till 12 or whatever it looks like, and they can swap over. That's quite good. Or night, they take it in turns of each night. Some, obviously, with breastfeeding, obviously that mum has to wake up quite a lot. However, there are ways where you can kind of express at night, if that's helpful. Again, milk production really does peak at night time, which is so tough. Even then, partner can like do the nappy change and settling back, and just thinking about that flow, really.
And like what works best, because I think the other thing as well, like you said, it really depends on the couple. But some dads are back to work full time after 2 weeks. You know, if you only have statutory, so then there's kind of like, oh, is it just going to be mum doing everything, and then dad has to sleep because he has to like maybe drive to work or whatever. But I think parents that I've seen that the dynamic works really well is when they do one night each. So then at least you have one parent that does have a full night's sleep. And I think it's just hard early on because you can't really plan for it, can you? You don't know what it's actually going to be like. So I think early on, when I've seen mums that are breastfeeding that maybe they're not expressing, or babies not having a bottle yet, what I've seen dads doing is dads will just do everything they can, which obviously isn't feeding. So the mum will, let's say they're co-sleeping, mum can feed, but then dad will take the baby and like do their nappies and do everything else, and that seems to work quite well from what I've seen. But I think that the ones that are breastfeeding is obviously harder, isn't it? It's a lot harder.
So when we think about sleep training, I first want to say sleep training now has become this really kind of big buzzword,
like a trendy thing.
Yeah, and sometimes when we think about sleep training, parents think, oh no, I can't sleep train, because they're so used to that old way of crying it out as such. And so we want to think about actually what is sleep training. Sleep training can be a range of techniques to help baby sleep ultimately, and that can be very appropriate for babies under 1, even though they're expected to wake up. We can still look at things to help. So in the first, I would say, under kind of 4 months, we expect sleep to be very, very up and down. And so I wouldn't recommend any sleep training techniques at all, because it just won't work. Babies are meant to be waking frequently, they're growing, feeding, they're cluster feeding a lot more, that kind of stuff. So we won't expect anything like that. But around kind of, I would say 3 to 4 months, they start to get their melatonin, which is that helps their circadian rhythm, and they get a little bit more sleep structure. The other thing to think about, so babies then from 6 months can go into their own room. Because obviously we want to think about babies sleeping with parents. That really helps their sleep regulation and also their breathing regulation, which is amazing. They can really sense it.
That's crazy.
It really helps them regulate.